Hi guys, welcome back to Dogshala. So yes, we are again back with one more previous year question series that is for your INICET MDS, which is happening in May, that is on May 19th. So yes, we are going to revise a few questions as I have promised you on Instagram, and of course I have got a mixed response whether you want in PYQ series or whether you want GP. So I've got like almost like it was 50 to 50%, like 50% asked for PYQ, 50% asked for grant test. So yes, I am providing both of them. So we have curated both. So yes, the grant test series is already we have been keeping you the grant test series details on the Instagram already, so you can check it out, and as well as on Telegram. So grant test series, we'll be conducting 3 grant tests for INICET MDS alone, that is happening in May, so that you get prepared with all kinds of questions and you get prepared to you can stimulate the exam environment in your own home and try to practice as many MCQs as possible. And the best feature that we are giving in this grant test series is that we'll be you can even review the questions for almost like a month, like even after the exam. So we'll be providing a validity till May 20th, so you can review the exam questions and even learn from the explanations. So yes, let's start with this series now. So yes, of course, today's topic will be about replacement resorption. So you have to be very particular about this thing. So this thing is like you have to know about resorption very well. So the resorption includes like all the types of resorption that we have, that is internal resorption, external resorption, and replacement resorption. Everything you have to have a clear idea of the clinical features, the radiological features, and everything before you go to the exam. Okay, so let's just dive into replacement resorption alone in this video, right? So there was a question which was asked in a recent 2023 exam. So the question was, an avulsed tooth which is replanted 1 year back shows loss of lamina dura. So the important this thing here is, I am just marking out the important these things. So loss of lamina dura was observed, and also radiographically, that is, there is a loss of lamina dura and high metallic sound on percussion. The type of resorption will be, so the options given were replacement resorption, inflammatory resorption, external resorption, and as well as internal resorption. So let's just see only about replacement resorption in here. So I know you all are already prepared with the inflammatory, external, and internal resorption. If not, do comment below. I'll try to cover those resorptions as well in our next video, right? So let's just see what is replacement resorption now. So replacement resorption, which is also known as replacement root resorption or ankylosis of the tooth, which it occurs when the periodontal ligament is replaced by bone within the root socket. So you can see this is the periodontal ligament, right? So this will be replaced by bone. So when this is replaced by bone, then it is called as replacement resorption. So this is often seen in avulsed teeth. Okay, so these are the key points you have to remember, right? So next, what is the pathophysiology behind this? So how is this bone getting replacing the periodontal ligament? So what happens is, when the avulsion happens, that is when the tooth is getting out of its socket, what happens is the PDL cells are damaged or destroyed. So when these PDL cells are damaged or destroyed, what happens is the separation happens between the socket and the tooth, right? So the socket is like this and the tooth is like this, and this is avulsed. These PDL cells get damaged and there will be a separation. So when that separation is happening, the surrounding bone, of course, the socket is bone, right? This is a bone. So the surrounding bone cells, that is the bone cells which are osteoclasts, they begin to resorb the cementum and dentin of the tooth root directly. So what happens? They osteoclasts resorb cementum and dentin of the tooth root. So as the resorption progresses, the bone tissue gets filled into the resorbed areas, which leads to direct fusion of the tooth root to the surrounding bone. What happens? The tooth root gets fused into the surrounding bone. So that is why this tooth is not movable. This doesn't have any cushioning effect which will be provided by the PDL and everything. So that's why this is called as replacement resorption. The here the cementum and dentin are replaced by bone. Okay, so this is what has happens in replacement resorption. So the clinical features include, the main clinical features which you have to have in your mind are the radiographic features. So as I told, since there is avulsion, there is loss of periodontal ligament space, which results in lack of normal radiolucent line surrounding the tooth. Of course, the PDL which appears on the radiograph as lamina dura is lost. Okay, this lamina dura is lost, as you can see in the radiograph here. So here you can see, so the lamina dura is lost. This tooth is having lamina dura, right? This tooth is not having lamina dura, so you can see the hollowness surrounding the tooth. So this is what happens in while the periodontal ligament space is lost. So the clinical examination is, we can see a high pitched metallic sound which appears on percussion. So on percussion you will see a high pitched metallic sound which is due to direct contact between the tooth root and the surrounding bone. Okay, so this sound distinguishes from the tooth from the healthy one, right? So this is what happens in replacement resorption. So the answer will be, so they have given two clues. The two clues are, there is loss of lamina dura and there is high metallic sound on percussion. So based on these two clues, the answer will be replacement resorption. Okay, you kindly go through your notes and make the features of these three a very important thing, because since they are asked in the options, based upon these options there might be other questions that might be repeating in your nearby exam. Okay, so I hope you got what replacement resorption is. So yes, as I've told, the grand test mock series is already getting registered, like almost most of the people are getting registered, because it covers all your high yield topics in the form of MCQs and also previous year questions, the image based questions, the clinical questions, everything is covered here. So I recommend you to go for the grand test mock series and test yourself before your exam day. Thank you.